Hello everyone. In this video, we're diving into a topic that's essential for many, yet often overlooked: pelvic floor exercises specifically designed for urinary incontinence. Whether you're a woman dealing with stress or urge incontinence, or a man facing issues like weak pelvic floor, or even prostate problems, this video is your go-to resource. We'll be talking about the evidence behind these exercises, how to do them correctly, and answer some frequently asked questions. So stay tuned. Welcome to the health sphere. We provide health advice based on personal experiences, research, and what's worked for others. This information is for general knowledge and should not replace professional medical advice. If you're new here, hit that subscribe button to join our health community and stay updated with our latest videos. Urinary incontinence, a condition that affects millions, is often addressed through medications. However, there's a cornerstone solution that frequently gets overlooked: pelvic floor muscle training, also known as Kegel exercises. These exercises are not just recommended by healthcare providers, they are supported by robust scientific evidence. A study involving over 2,600 women across 5 continents found that pelvic floor muscle training was more effective than medication in treating stress urinary incontinence. And guess what? It was also better than medication in treating urgency, urinary incontinence. The benefits didn't stop there. Women who engaged in these exercises experienced less leakage, fewer pads used, and improved quality of life. But wait, there's more. For men, the outcomes were equally impressive. When comparing surgery to pelvic floor muscle training for men with an overactive bladder, surgery showed no additional benefit. This means that for many men, pelvic floor exercises might be a preferred option over surgical interventions. And let's not forget the impact on quality of life. A whopping 77% of men reported improved quality of life after just 3 months of daily practice. But hold on. Are you thinking what I'm thinking? How do I do these exercises? Well, you're in luck, because we've got you covered. Let's dive in. When it comes to performing Kegels, following the right technique is paramount. Here's a breakdown of how to do them effectively. Step 1. Find your starting position. Start by sitting down, relax your body, and take a deep breath in and out. This helps you relax and find a comfortable posture. Once you feel grounded, move into a standing position. Stand with your feet apart and your knees slightly bent. If you prefer, you can do this while sitting or lying down. Just make sure you're relaxed. Step 2. Identify your pelvic floor muscles. Imagine you're trying to prevent yourself from urinating or stopping the flow of urine midstream. That action automatically engages your pelvic floor muscles. You might also try to lift your buttocks cheeks as if you were about to sit back into a chair. This motion further activates your pelvic floor. To ensure you're targeting the right muscles, try placing a finger or two at the opening of your vagina or anus. As you perform the exercise, you should feel the muscles around these areas lifting and tightening. Step 3. Perform the actual Kegel. Now that you know where to start and which muscles to engage, it's time to perform the Kegel. Begin by gently contracting your pelvic floor muscles. Hold that contraction for a couple of seconds, and then relax. The key here is to focus on slow, controlled movements, rather than rapid repetitions. Aim for 15 to 20 repetitions, divided into 3 sets with a few seconds rest in between each set. Practice these daily and gradually increase the hold time to up to 10 seconds. Over time, you can work your way up to holding the contraction for 10 seconds, still in 3 sets with rests in between. The frequency of your practice might vary based on individual needs and progress. However, a good rule of thumb is to aim for at least 3 times a week. Consistency is key when it comes to seeing results. Let's address a common question. Do I need to contract my abdominal muscles when doing Kegels? Absolutely not. In fact, it's essential to relax your abdominal muscles as you perform Kegels. Tensing your abdominal muscles can interfere with the effectiveness of the exercise and potentially cause discomfort or strain. Focus on keeping your abs relaxed and engaging only your pelvic floor muscles. Another frequent question is, should I contract my pelvic floor muscles while breathing? Ideally, you want to avoid holding your breath during Kegels. The best approach is to breathe normally throughout the exercise. This means inhaling and exhaling calmly and steadily while maintaining the contractions. If you find yourself involuntarily holding your breath, make a conscious effort to relax and resume normal breathing patterns. It's important to note that while Kegels are generally safe for most people, there are certain situations where you should exercise caution. If you've been diagnosed with a high-tone pelvic floor, this means that your pelvic floor muscles are already tight and overactive. Performing Kegels in this state could exacerbate the problem. Additionally, if you're experiencing severe pain or discomfort in your pelvic region, it's crucial to consult with a healthcare provider before attempting Kegels. Similarly, if you're pregnant or have a history of pelvic surgeries, it's essential to seek guidance from your doctor or a pelvic floor specialist before starting any Kegel regimen. They can help you determine if the exercises are safe and appropriate for your specific circumstances, and may also provide modifications or alternative exercises. Now let's tackle a question that often arises. Can men benefit from doing Kegel exercises? Absolutely. Kegel exercises aren't exclusive to women. Men can reap the same benefits. Specifically, these exercises are beneficial for men facing issues like weak pelvic floor, rectal dysfunction, or even prostate problems. The great news is that the same principles apply. By following the steps outlined earlier, men can strengthen their pelvic floor muscles and potentially improve their sexual function. While the benefits of Kegel exercises are evident, it's essential to acknowledge that they might not be a one-size-fits-all solution. For instance, studies show that about 38% of women don't respond to these exercises for stress urinary incontinence. Similarly, about 46% of men with overactive bladders don't see significant improvements. Several factors can influence the effectiveness of Kegels. These include the severity of your condition, adherence to the exercise regimen, and individual response to treatment. When Kegels don't yield the desired results, there are alternative treatment options available. For women, these might include pessaries, which are devices used to support the pelvic floor, or mid-urethral slings, a surgical procedure to tighten the urethra area. For men, options might range from bladder Botox injections to percutaneous tibial nerve stimulation. This involves implanting a device that sends electrical impulses to the bladder to regulate its function. In more severe cases, there's always the possibility of an artificial urinary sphincter, surgically implanted device that helps control urinary leakage. Now let's talk about an often overlooked aspect of strengthening your pelvic floor muscles: manual techniques. These hands-on exercises offer an additional layer of support and can be particularly helpful when combined with Kegels. A recent study involving 224 women found that a combination of manual techniques and Kegels was more effective than Kegels alone in treating stress urinary incontinence. These techniques typically involve a therapist or healthcare provider applying pressure to specific points or areas to help relax or strengthen pelvic floor muscles. While they might not be suitable for everyone, they can be a valuable addition to your treatment plan under the guidance of a qualified professional. As we wrap up, remember that while pelvic floor exercises are a powerful tool for managing urinary incontinence, they might not be the solitary solution. It's essential to adopt a comprehensive approach to treatment. This includes maintaining a healthy diet, staying physically active, practicing good bladder habits, and managing any underlying health conditions. Do not hesitate to consult with your healthcare provider or a pelvic floor specialist for personalized guidance and to explore all available treatment options. That brings us to the end of this video. We hope it's been informative and empowering. If you've enjoyed the content, please give us a like and share it with anyone who might benefit. Your support means everything to us. Stay healthy and keep thriving.